As you are well aware, in Nigeria, the population is over 200 million.
I don't want to carry another pregnancy, eh?
Many women are willing to prevent unwanted pregnancies, but they do not know how to do that.
Resilient and accelerated scale-up of DMPA-SC self-injection in Nigeria, RASuDiN project, supported by the Bill and Melinda Gates Foundation and Children Investment Fund Foundation, aims to expand family planning method choice and empower women by supporting the rollout of DMPA-SC and community-initiated self-injection in Nigeria.
It is important to recognize that there are many people who are disadvantaged. And because they are disadvantaged, they are not able to access, many of the modern contraceptive methods.
A RASuDiN project was designed to introduce and scale up the use of press or DMPA-SC in 10 selected states in the country.
We built the capacities of healthcare providers at the primary healthcare level. We also built the capacity of community workers.
We go into the community to sensitize about family planning.
I got to know about press through the COPs.
At the clinic.
DMPA-SC/SI allows women to give themselves the injection rather than visit a health facility.
Not all women like injecting themselves because of the fear of the needle.
Fear, no fear is all, because I don't want to carry another pregnancy, eh? So it's very picture.
Self-inject is something that gives ownership back to the woman.
By giving it by yourself, to help you to reduce time wasted, transportation from your house to the health center, then queuing up to wait for your turn.
I can take it by myself in the shop or at home, so I can take it anywhere.
The diabetic patients can inject themselves with insulin, so why not a method of contraception that's equally simple to administer?
DMPA-SC self-injection is discreet and easy to use.
All through 2021, from January to December, we have about 12,464 persons that is on DMPA.
I can boast of more than 50 in a month of DMPA-SC.
We started with as low as 300 uptake, down to 500. Now we are counting above 1,000.
In a short time, we've seen change from people who even did not have knowledge or have the correct information to actually uptake the service.
Yeah, we are very happy with what we've achieved on the RASuDiN project. In the first year when we started at the baseline, the uptake was just 5 uptake of DMPA-SC. Now the first year, over 17,000. At the second year, over 200,000. Right now, as we are talking, the data we have is up till April.
Cumulatively, we have initiated over 71,000 women on self-injection. This is very historical.
The concept of self-inject probably should have been with us long before now.
Right now, we have a lot of other programs who are actually piggybacking on the work that RASuDiN has done within the communities, and we're hoping that as a state we'll be able to sustain that going forward.
We refer to the sustainability within this project as Journey to Self-Reliance.
The Lagos state government are actually, taking steps to take ownership of the activities of the project.
So yes, the state is planning to keep a number of our community volunteers as agreed in our state task force meeting.
Government is ready, to take up this responsibility.
We want to appreciate the support of the Bill and Melinda Gates Foundation and the Children Investment Foundation funds.
Well, I would like to say thank you to ARFH for the RASuDiN project. It's something that we realized was missing within our program.
To the donors and to the ones that invented this, within me, my humble self, I say bravo to them all.
Give kudos to them.
They have tried.
RASuDiN try well. Yes, to an extent, I think the team has done well.
As of July 2022, all the 4-year projections for the RASuDiN project were surpassed. Total uptake of DMPA-SC increased to 1,072,046. Total new acceptors of family planning method increased to 2,739,926. New acceptors of DMPA-SC increased to 562,517. Total self-injection increased to 94,942. The proportion of new acceptors of DMPA-SC to SU acceptors of all family planning methods increased to 21%.
People are now aware. They are on it.
I can have fun anytime I want without being scared of getting pregnant.
I wish they would not go.
I would have liked them to stay longer.
More concerted efforts are needed to scale up the intervention to other parts of Nigeria.
I think for me, reduction in mortality morbidity is a plus for this product.
So one can see that the government of Nigeria is set out to be intentional about the population management of Nigeria.
DMPA-SC Self-Inject, empowering women to take charge of their reproductive health.